Today we're diving into a topic that affects millions of people worldwide: hemorrhoids. We're going to cover everything you need to know, from what causes them to how you can get rid of them naturally and medically. So, if you're looking for a comprehensive guide on how to get relief from hemorrhoids, stay tuned. We'll break down home remedies, lifestyle changes, and medical treatments. Let's get started. What are hemorrhoids?
Hemorrhoids are swollen blood vessels located in the lower rectum or anus. Though they can also afflict younger people, they are a highly prevalent disorder, especially in persons over 50. Both internal and external hemorrhoids are possible within the rectum under the skin around the anus. Hemorrhoids don't pose a threat to life in and of themselves, but they can cause pain, bleeding, itching, and discomfort. If you don't address the disease, the symptoms usually get worse, but if you take the appropriate steps, you can either prevent it entirely or at least lessen it.
Types of hemorrhoids. Do it.
Understanding the different types of hemorrhoids is essential to effectively treating them. There are two main types.
1. Internal hemorrhoids.
Internal hemorrhoids form inside the rectum and are generally painless because there are few pain-sensing nerves in this region. If they don't start bleeding, which is usually the first indication, you might not even see them. Bright red blood on toilet paper or in the toilet bowl may indicate bleeding that happens during bowel movements. Internal hemorrhoids can prolapse or extend outside of the anus on occasion. Prolapsed hemorrhoids can occasionally be felt as soft lumps around the anus and can cause pain, discomfort, or itching.
2. External hemorrhoids.
Hemorrhoids from the outside appear beneath the skin near the anus. Because there are so many nerve endings in the skin surrounding the anus, these can be more unpleasant. When a person strains during a bowel movement, they frequently cause irritation, edema, pain, and even blood. A painful blood clot forms inside the enlarged vein, resulting in a thrombosed external hemorrhoid. Severe pain, edema, and a hard mass around the anus may arise from this.
What causes hemorrhoids?
Hemorrhoids occur due to increased pressure in the lower rectum, which can cause the veins to swell and become irritated. Some common causes include 1. Straining during bowel movements, struggling to pass feces, or experiencing prolonged constipation is one of the main causes of hemorrhoids. Increased pressure can cause vein irritation and enlargement. 2. Sitting for long periods. Rectal vein pressure can increase from prolonged periods of time spent on the toilet or by sitting for extended periods of time at work. 3. Chronic diarrhea. Diarrhea can also cause hemorrhoids because it can lead to frequent bowel movements. 4. Obesity. Hemorrhoids may occur as a result of increased pressure in the abdominal and rectal regions caused by being overweight. 5. Pregnancy. Hemorrhoids are common during pregnancy due to increased pressure in the abdomen and hormonal changes that affect blood flow. Swelling results from the uterus's pressure on the rectum's veins as it grows. 6. Low-fiber diet. A low-fiber diet can cause straining during bowel movements and hard stools, both of which increase the risk of hemorrhoids. 7. Heavy lifting. Regularly performing heavy lifting can raise abdominal pressure, which might hasten the development of hemorrhoids.
Symptoms of hemorrhoids.
The symptoms of hemorrhoids vary depending on whether they are internal or external, but common signs include bleeding. Bright crimson blood on toilet paper or in the toilet bowl after a bowel movement is often a sign of hemorrhoids. Itching or irritation in the vicinity of the anus. External hemorrhoids may cause itching and discomfort. Swelling. External hemorrhoids may be indicated by swollen areas surrounding the anus. Pain or discomfort. External hemorrhoids, especially if thrombosed, can be very painful. Lump near the anus. A tender or painful lump around the anus could indicate a thrombosed external hemorrhoid. Prolapsed hemorrhoids. If internal hemorrhoids push through the anus, you might feel a soft lump that can be pushed back inside or may need medical intervention.
To get rid of hemorrhoids naturally.
For mild hemorrhoid cases, home remedies and lifestyle changes can be highly effective. Here's a step-by-step guide on how to get rid of hemorrhoids naturally.
1. Eat a high-fiber diet.
Eating more fiber is one of the best strategies to treat and prevent hemorrhoids. Fiber makes your stool softer and more substantial, which lessens the effort required to pass gas during bowel movements. Make sure you consume 25 to 30 grams of fiber daily, which can come from the following foods: fruits, apples, pears, berries, vegetables, broccoli, spinach, carrots, legumes, beans, lentils. Fiber supplements like psyllium husk or methyl cellulose can also be helpful if you're struggling to get enough fiber from your diet.
2. Stay hydrated.
The water consumption keeps your feces soft and simpler to pass. Try to drink 8 to 10 glasses of water each day, more if you're adding more fiber to your diet. Dehydration can worsen the symptoms of hemorrhoids and constipation.
3. Don't strain during bowel movements.
Stretching when using the restroom might exacerbate pre-existing hemorrhoids or produce new ones by increasing pressure in the rectum's veins. Aim to use the restroom for no more than a few minutes at a time. If you're experiencing difficulties, try not to strain and think about using a stool softener to make bowel motions easier.
4. Use a squatting position.
While having bowel motions, it can be very beneficial to adjust your position. It can be simpler to pass stool without straining if you use a little stool to elevate your feet while sitting on the toilet. This will help align the rectum. Pressure on the rectal veins is lessened in this squatting-like posture.
5. Apply cold compresses.
Applying an ice pack or cold compress to the afflicted area for 15 to 20 minutes can help minimize swelling and ease pain in cases of external hemorrhoids. You prevent the ice pack from coming into contact with your skin. Make sure you cover it in a cloth.
6. Take warm sitz baths.
2 to 3 times a day, a sitz bath entails bathing the anal region in warm water for 10 to 15 minutes. Soaking in warm water eases discomfort, itchiness, and edema. You can sit in a heated, shallow tub or use a sitz bath kit that fits over your toilet seat.
7. Use witch hazel.
An all-natural astringent that can help lessen hemorrhoidal itching and pain is witch hazel. Using a cotton ball, apply witch hazel directly to the external hemorrhoids. Alternatively, use pre-soaked pads made especially for hemorrhoid relief.
8. Aloe vera.
Because of its anti-inflammatory qualities, aloe vera helps relieve the discomfort that hemorrhoids bring. Look for pure aloe vera gel that doesn't have any chemicals or scents added, then carefully apply it to the affected region. To rule out any allergic reactions, make sure you try it on a small patch of skin first.
9. Avoid sitting for long periods.
Long periods of sitting might increase the pressure on your hemorrhoids. Try to get up and move around every hour if you work a desk job to reduce stress.
10. Maintain a healthy weight.
Being overweight puts additional strain on your pelvis and rectal region, which can lead to the development of hemorrhoids. Hemorrhoids can be prevented by eating a balanced diet and getting regular exercise to maintain a healthy weight.
Medical treatments for hemorrhoids.
In the event that using home remedies is ineffective or your hemorrhoids are extremely painful, you may need to seek medical attention. This is a thorough examination of some of the most popular medicinal remedies for hemorrhoids.
1. Over-the-counter medications.
Several over-the-counter OTC treatments can help relieve hemorrhoid symptoms. These include topical creams and ointments. Itching and pain can be relieved by products that contain substances like phenylephrine, lidocaine, or hydrocortisone. Seek for lotions for hemorrhoids such as Preparation H or its generic substitutes. Medicated wipes after a bowel movement. Soothing wipes with witch hazel or aloe help soothe the area and keep it tidy. Suppositories for internal hemorrhoids. Suppositories that contain soothing ingredients like hydrocortisone can reduce inflammation and discomfort.
2. Stool softeners.
Stool softeners such as docusate sodium choline can help soften stools and make them easier to pass without straining if constipation is a factor in your hemorrhoids. By doing this, you can stop more aggravation and let your hemorrhoids recover.
3. Rubber band ligation.
For larger or more persistent internal hemorrhoids, a doctor may recommend a procedure called rubber band ligation. During this process, the hemorrhoid's blood supply is severed by wrapping a tiny rubber band around its base. In a few days, the hemorrhoid will finally shrink and come out. This is a relatively short recovery period for a minimally invasive surgery performed in a doctor's office.
4. Sclerotherapy.
In order to reduce the hemorrhoid, sclerosing therapy entails injecting a chemical solution into it. This treatment can be performed in a doctor's office and is frequently used for minor internal hemorrhoids. Although less traumatic than rubber band ligation, it might not work as well on bigger hemorrhoids.
5. Infrared coagulation IRC.
By heating the hemorrhoidal tissue with infrared light, infrared coagulation stops the tissue's blood supply and causes it to contract. This operation is done in a doctor's office and is also utilized for minor internal hemorrhoids. IRC is normally painless, rapid, and doesn't require anesthesia. 6. Hemorrhoidectomy. Hemorrhoidectomy may be required in severe cases of hemorrhoids that don't improve with other therapies. The entire hemorrhoid tissue is removed during this surgical treatment. Large prolapsed or thrombosed hemorrhoids that produce severe discomfort or bleeding are usually the only situations when it is used. Although hemorrhoidectomy is incredibly successful, it also involves more intrusive procedures and takes longer to recover from. Although there may be some pain and suffering following surgery, hemorrhoids can be permanently removed.
7. Hemorrhoidopexy stapling.
Hemorrhoidectomy can be substituted with a less invasive procedure called hemorrhoidopexy, or stapling. In order to reduce the prolapsed hemorrhoid and reinsert it into place, a stapling device is used to cut off its blood supply. Stapling is mainly limited to prolapsed internal hemorrhoids since it is less invasive and requires less recovery time than a standard hemorrhoidectomy.
Mention tips how to avoid hemorrhoids.
After treating hemorrhoids, you should take steps to keep them from recurring. These are a few easy actions you can do to lower your future risk of hemorrhoids.
1. Eat a high-fiber diet.
Fiber is your best line of defense against constipation and straining during bowel motions. As was previously indicated, you can avoid hemorrhoids and maintain a regular digestive system by include a lot of foods high in fiber in your diet.
2. Stay hydrated.
Eating adequate fiber and drinking enough water are equally important. Water softens the feces, facilitating easy passage without exertion. Try to drink 8 glasses of water or more each day, especially if you're also consuming more fiber.
3. Exercise regularly.
Constipation can be avoided and a healthy digestive system is encouraged by exercise. Maintaining a healthy weight also helps to relieve strain on your rectal veins, which can be achieved through regular exercise. Diligent walking, swimming, and yoga practitioners can especially help support gut health.
4. Don't ignore the urge to go.
Don't wait to have a bowel movement when the urge strikes. Stool retention can cause constipation and more straining when the time comes to poop. Pay attention to your body and leave when necessary.
5. Avoid prolonged sitting.
Extended durations of sitting, especially while using the restroom, unnecessarily strain the veins in the rectum. If you work at a desk, remember to get up and move about every hour.
6. Use good bathroom habits.
When you're having a bowel movement, try not to strain or hold your breath. Instead, let gravity and the organic motions of your body do the heavy lifting. Use a fiber supplement or stool softener if needed to make things simpler.
To see a doctor.
Lifestyle modifications and home remedies can heal hemorrhoids. In many cases, medical intervention is sometimes required. Consult a physician if you experience rectal bleeding or notice blood in your stool. Your hemorrhoids cause significant pain or discomfort. You have hemorrhoids that last for more than a week without improvement. You feel a hard lump around your anus, which could indicate a thrombosed hemorrhoid. You experience a prolapsed hemorrhoid that cannot be pushed back inside. Recall that although hemorrhoids often pose no threat, they can also result in rectal bleeding from more serious diseases like colon cancer. To rule out any other possible problems, it's usually preferable to have checked out by a medical specialist. Although hemorrhoids can be an unpleasant and painful illness, there is good news: they are very treatable. Relief is achievable whether you choose for medical interventions, lifestyle modifications, or natural solutions. Take charge of your health by eating meals high in fiber, drinking plenty of water, and avoiding extended sitting or straining. If your symptoms persist or worsen, don't hesitate to appreciate you seeing the video for today. We hope this information was helpful to you. If so, kindly like, comment, and subscribe to our channel in order to receive more advice and insights about health. Please leave a comment below if you have any queries or suggestions for topics we should
Subscribe to my channel.